Thank you to everyone for joining us today. We're excited to have the next hour to discuss a topic that continues to impact the healthcare industry, workplace violence. Our goal for this session is that each of you leave with the tools that you need to highlight the financial impact of workplace violence to your organization and to your leaders, and the data to quantify safety investments to make a business case for stronger prevention methods. So here's our list of our objectives for this session. Through our conversation today, you'll walk away with tools that you need to help showcase the ROI on safety for your organization, why it pays to protect your people, and how to demonstrate that return in a meaningful way. We'll kick off the session today by looking at some of the latest data related to workplace violence and healthcare, explore the impact safety makes from a financial standpoint on the workforce and in patient care. And finally, we'll demonstrate how to calculate and present data related to a financial return on safety investments. So Stacy, do you want to kick us off here?
Yes. So as we know, workplace violence is still on the rise across the country. Last year, the National Nurses United published a study showing that 81% of nurse respondents had experienced workplace violence within the past year. 26% felt that violence had increased a lot in their unit compared to the previous year. But it's not just isolated to nurses. A recent American College of Emergency Physicians survey showed that nearly 3/4 of emergency physicians believe that violence they're experiencing is worse than last year. Leaders know that they have to take action, but there's still many organizations that either haven't because of competing priorities, lack of funding, or they've tried a few solutions, but they aren't seeing any sort of progress. To share additional takeaways from that survey, 91% of ED physicians said that they or a colleague had been threatened or attacked in the past year. 24% report being assaulted multiple times per week. It's really concerning because when you think about caretakers, these are the people who have a core value ingrained in them to care for others. But unfortunately, that kindness often gets taken advantage of and they become victims of violence. Now, in that ACEP survey, there's one data point that stands out as most alarming. Of those who did experience a workplace violence incident, 68% felt that their employer's response was insufficient, and 50% reported that nothing was done at all. Now, in some cases, things might be done, but it could be that perception as well. But as healthcare leaders, we have to do something. Similarly, in a Black Book research survey, while 100% of staff reported experiencing or witnessing workplace violence, nearly all of them felt that their current safety protocols were inadequate. This illuminates a unique perspective related to violence in healthcare. We know there's a problem. We know it needs a solution, but still the majority of us are failing to address it. So why is that? I think one of the biggest problems is that generally speaking, there's a widespread acceptance for underreporting. In fact, a recent study showed that as many as 80% of healthcare violence goes unreported. Some people just feel it's a part of their job, and when they cannot be, it really cannot be further from the truth. We can speculate and make assumptions as to why it's underreported, but the more important discussion is what impact does this have on an organization? So we explored this question at Unison Risk Solutions. We provide a dashboard to all of our TPA clients, which is there's a snippet right there on your screen. And I'd like to share some of this data with you. So over a 10-year period, over 5,700 employees have been injured by a workplace violence incident, and over $18 million has been paid out on workplace violence claims. One claim alone cost an organization $570,000. And this most likely does not encompass everyone who's had a workplace violence incident. We just talked about how it's underreported. And we may not be getting that full picture of what's going on at your organization if your employees are not reporting everything to you. This data is really just looking at healthcare as a whole, but if you get into some of the niche sectors where we know that historically incidents of violence tend to be higher, like in behavioral health units, the impact is even more substantial. Mental health care workers collectively lose about 6,000 days of work annually due to severe injuries caused by workplace violence. And these numbers just demonstrate that a strong risk management program is very important, not just for patients, but for the healthcare workforce as well.
Thanks for that, Stacy. And to add a bit more data in terms of the cost associated with workplace violence in healthcare, the AHA published a report a couple of months ago around the substantial financial impacts from violence. This included both violence within the hospital and the surrounding community. They showed that the total annual financial cost of violence for hospitals in 2023 was estimated at $18.27 billion. What's interesting is that they broke down pre-event and post-event costs and saw a significant difference between the two time periods. The report showed that for all hospitals, pre-event costs associated with violence were estimated at $3.62 billion. These were primarily dollars spent on prevention measures like training, technology, etc. In contrast, post-event spend was captured at approximately $14.65 billion and included costs for healthcare, work lost, case management, staffing, and infrastructure repair. But the largest contributor to that total of annual costs came from post-event healthcare experiences to treat injuries from violence. What this tells us is that hospitals and health systems that are proactively planning and investing in workplace violence prevention measures are not only preventing their staff from injury, but they're lowering their potential spend by up to 4 times annually. Additionally, over the last 20 years, research has demonstrated the effectiveness of workplace violence prevention measures, with studies documenting between an 18% and up to 66% reduction of incidents of violence after interventions were implemented. When we apply that to the costs associated with violence in healthcare, reductions of this magnitude can have a strong financial impact. But one of the problems hospital leaders struggle with is, how do I take this data and make it applicable to my facility or my organization? So we're going to try to help you do that today.
Definitely. So just as one example from one of my clients, we had a client who prioritized an initiative to improve workplace safety by implementing measures like de-escalation techniques, situational awareness training, panic alarms, a clear no tolerance policy, and visitor management. They were able to reduce injuries from workplace violence by 45%. It's a long-term process which needs commitment, but in turn, this program did lower their costs associated with workplace violence.
And to help you build this business case for safety investments, we've put together an ROI calculator. This resource allows you to input specific data from your facility, plus the projected impact across different areas. Then using published data to make assumptions, it enables you to calculate potential ROI compared to the investments being considered to improve safety. We'll run through an example in just a few minutes, but before we do that, I'd like to pull in our other panelist and guest, Nancy, to talk about one area where safety can have the biggest impact: workforce well-being. Nancy, how have you seen safety investments, or the lack thereof, impact the workforce?
Thanks, Andrea. And let me start off by saying that I think it's a unique time to be in healthcare. Executives have so much on their plate, from finances to staffing shortages, patient expectations, regulatory requirements, and constantly evolving legislation. They have a lot on their plate that they're responsible for, but there's one thread that goes through and impacts every single one of these priorities, and that is safety. When people feel safe physically and psychologically, everything improves, from retention, engagement, and ultimately patient outcomes. When employees don't feel safe, they have a similar reaction of affecting every part of the organization, from culture to finance. Let's start with retention and workforce stabilization, because that's where safety, or the lack of it, is most visible. A McKinsey & Company study found that safety is the #1 factor nurses consider when deciding whether to stay in their current position. Think about it. This ranked above compensation, team culture, and even work-life balance. This tells us something profound. Our people believe that feeling safe matters more than anything else. For the staff who experience violence or aggression, the emotional toll can lead to anxiety, depression, and even PTSD. And that's how turnover starts, not with a resignation letter, but with disengagement. A study published by the CDC showed that healthcare workers that experience violence are more likely to feel anxious, depressed, and burned out than those who did not. 85% report anxiety, 60% reported depression, and 81% reported burnout. And these numbers range from 57 to 93% higher than healthcare workers who did not suffer any harassment in the workplace. This is why psychological safety is so critical. If our teams feel unsafe, they operate in survival mode. They're hypervigilant, they're distracted, and even exhausted. When they know leadership has their back, when they see visible and tangible signs that there are investments in their safety, their mindset shifts. They can focus on what matters, caring for patients. Investing in safety solutions like wearable duress buttons sends a very powerful message. You are not alone. Help is one button away. But it's not just the technology. It's a symbol of support that builds trust and confidence.
Nancy, I agree. When an employer takes the time to evaluate their workplace violence data and incidents or injury to staff, their people do notice. And when organizations continue on that path and implement corrective measures such as better visitor management, patient codes of conduct, EMR alerts for history of workplace violence, which someone noted in the chat just now that they use Epic to notify of a history of workplace violence, and badge access controls, to name a few, then workforce engagement does increase and incidents of violence drastically decrease. But prevention is the key here. Violence is not a part of the everyday job, and our healthcare leaders have the power to help change that narrative.
That's right. When people don't feel safe, they leave, and that cost is enormous. According to the 2025 National Healthcare Retention Report, the average turnover cost for a single RN is over $61,000. That equates to $3.9 to $5.7 million per hospital lost every year. And here's a data point that you can leverage in your own research as you track and go through this process. Every 1% change in RN turnover, and that could be positive where you're retaining staff, or negative where you're losing staff, can cost a hospital $289,000 annually. So think about it. Just a small change in keeping numbers of RNs or letting them go impacts an organization by just under $300,000. And I want to emphasize, those are just the visible costs. And we recognize that this is so much more important is the people side of the equation. The hidden costs of unsafe environments are just as damaging, if not more so. When incidents occur, assaults, verbal threats, abuse, they create ripple effects. Productivity drops, workers' comp claims rise, morale decreases, and trust in leadership and the organization erodes. Now let's look at the connection between staff safety and patient experience, because they really are inseparable. When staff feel unsafe, patients feel it too. Safety isn't invisible, it's palpable. Patients can feel when staff are rushed, distracted, and anxious. A study published in the Journal of Nursing Care Quality shows a result of an analysis identifying the relative ranking of 13 workplace conditions predicting quality and safety of patient care. For patient safety, physical safety had an important score of 35.58 and psychological protection 27.78. These were ranked as two of the top 3 most important workplace predictors of a patient safety grade. Another Study published in Health Policy demonstrated that a 10% increase in intention to leave increased the likelihood of inpatient hospital mortality by 14%. And think about it, when people leave, it is not only that you have to recruit and orient new staff, it's also that it erodes some of the reliability that team members have between themselves working together over time. On the flip side, when nurses and clinicians feel secure, they engage more fully. They're calmer, they're more attentive, they're more compassionate. And that's what drives HCAP scores and value-based purchasing outcomes. Remember, patient experience is not a soft metric. It is tied to reimbursement, public reputation, and community trust. This same study cited that better work environments reduce the likelihood of job dissatisfaction, burnout, and intention to leave by 28 to 32% for nurses. So when we invest in safety, we're not only reducing risk and turnover, we're strengthening outcomes and the patient experience, which drives revenue and loyalty. Safety is a force multiplier. It impacts everything from risk to quality and finances. I've seen firsthand how having a confident and calm workforce transforms the patient environment. If you walk onto a unit where there is a sense of order, patients feel the compassion of the nursing staff and the other ancillary providers, and there's a sense of confidence. That creates a sense of order, and truly a culture of safety is reflected. Of course, sustaining safety requires leadership, and I can't emphasize this enough. If safety isn't a boardroom priority, it won't become a frontline reality. This is where leaders, especially risk and nurse execs, play a pivotal role. Safety has to be part of the strategic plan, the budget, and the executive scorecard. It must be visible and tied to initiatives that are being tracked, because people pay attention to what leaders prioritize, measure, and fund.
Thanks, Nancy. That's a perfect segue into what we're excited to look at together today, which is the ROI calculator we mentioned earlier. The question we're trying to answer here is, for all the data and stats that we just reviewed, how can that be taken and applied to individual facilities or across organizations? So we're hoping to help you do just that by sharing this calculator. The ROI calculator we've developed, it leverages all of the data we spoke through today and built it into a tool that you can easily use to make financial assumptions for the return on prioritizing and investing in safety. You have two options for calculating an estimated return on safety investments. I'll walk you through those and some examples. First, you can either do a little research to gather things like your current RN turnover rate, workplace violence claims over a year, lost time incidents in a year, but that obviously takes a lot of time and effort. Your second option is to use pre-populated estimates based on published data and apply it to your organization. In this example, you'll see we went with inputs based on national averages, and you only need to input staffed hospital beds, RN headcount, and safety investment costs. So those areas in the blue toward the top. For safety investment costs, you can combine the cost of the programs you're currently evaluating, or if you're not that far along, you can make some projections based on safety investments you've considered, like wearable duress buttons, de-escalation training, etc. Then the ROI calculator will help you apply assumptions based on findings from the AHA, NSI, and more. So now that we have our baseline information, let's walk through an example so you can see this calculator in action. In this example, we're going to estimate 135 beds for an organization, 500 employees, and of those 190 RNs. We're estimating our current incident and claim data based on national averages and leveraging the AHA report data to make an assumption that through safety initiatives, we can reduce incidents of workplace violence by 35%. The average RN turnover nationwide is 16.4%, and we're looking to reduce that by 2 points over the next 12 months. Again, if you have your own individual numbers for cost per RN lost, you can account for that. Otherwise, you can use the standard average across all hospitals of $61,000. Same with the average cost per workplace violence claim costs. You're able to fill those numbers in if you have those specifics for your organization. Otherwise, you can leverage the national average to save time and research. So, based on the numbers we provided for this example and applying national averages versus specifics of your organization, we can project a yearly savings of $281,000 by investing in safety for your staff. Now, let's calculate net savings. And in this example, let's say that we're considering implementing wearable staff duress buttons for all staff members and a hands-on de-escalation certification program. We're going to estimate that a total around $150,000 of investment, which gives us a net annual savings of $131,000. These are some big numbers, and they're tangible, and you can show exactly how you got there and the assumptions you're making based on very recently published data or your own information. In many situations, this could be very impactful when it comes to convincing the leaders across your organization to fund safety initiatives. And you're probably wondering, how do I get my hands on this calculator? Well, we're excited to share that this tool is now available on CENTEGIX.com, and we'll send it to you as an asset following this webinar as well. So you can plug in your own data and download your work. I'll also quickly show you two other examples so you can see the magnitude of impact because of safety investments and how this scales to larger facilities. So here you can see the calculator outputs for a 300-bed facility and a 600-bed facility. We modeled based on higher RN count and higher investment costs, but kept the national average assumptions the same. Look at these total annual savings. This is a great story to bring to the leaders in your organization. This just showcases the financial impacts. But remember, there are also impacts to well-being, patient care, and so many other areas that are not calculated here. When we talk about creating a true culture of safety, there's an unmatched value in that for your staff and patients. Let's go back to what we discussed at the beginning of this call, which is that every leader must likely agree with the fact that violence in healthcare remains to be a large concern and that we've got to do something to change it. But believing that truth doesn't help solve for the fact that budgets are tight. Recent legislation is creating a lot of financial uncertainty, and every dollar is being scrutinized to see if it's worth spending. Being able to paint a detailed picture of what your organization is seeing and spending right now and what you believe you could improve upon with dollars and cents attached is going to help you get those conversations pushed further along with a decision-making audience. You're not just saying, we know we need this. You're saying, we know we need this, and there's a business case that supports it. Our hope is that by showcasing this value, healthcare organizations like yours will be more successful in implementing the technology and tools needed to better protect their workforce and help people feel and be safer every day. So to close us out, Nancy and Stacy are going to talk through next steps and what to do after this session to keep the momentum going.
Thanks, Andrea. If you're ready as a risk and safety leader to start increasing workplace safety, here are a few practical next steps I encourage you to take. First, establish a baseline in your organization. Use perceptions data and also use your incident report information to understand where your risks and gaps really are. Build a cross-functional team. Membership from risk, nursing, behavioral health, and other frontline staff makes a big difference. It builds the depth and breadth of knowledge and can reveal different perspectives as to risk. Communicate consistently. Use internal channels to reinforce the message that safety is a shared priority. Celebrate successes and transparency. Track and share progress. Visibility builds accountability. Share metrics, highlight improvements, and show staff that their feedback really does matter. And empower with tools, because evaluating solutions is so important, and they need to be scalable and intuitive, like wearable duress buttons that work campus-wide, indoors and out, and make sure they address the unique needs of your facility and can grow with you.
I agree with all of those suggestions, Nancy. And focusing on reporting of injury data and reporting is one way to get workplace violence program off the ground quickly. And we talked about underreporting. So really talking to staff about reporting all incidents, even minor ones that you can capture a clear picture of, that workplace violence incidents that you are seeing within your organization. Then follow that with assessments, awareness, and education. But some other things to think about. Do you or your broker or your carrier have a robust system for you to track your injuries like I showed earlier? So it's really important for you to be able to trend the data the way you need it. You should be able to slice and dice it any way you need to get a clear picture of what's going on at your organization. But then what are you doing with that data? If you have it, you need to use it. So really digging deep and figuring out what's going on can help you with those prevention measures and what you might need to implement. Are you using EMR triggers to warn of workplace violence history? Or do you have any notification system in place to notify staff of patient issues or aggression? The feedback on this I often hear is there's a concern of profiling, but a consistent reevaluation process is really necessary to avoid putting someone in a box that they don't necessarily belong into permanently. So consistently reevaluating that process. But if the patient has a history of long-term violence to healthcare workers, especially, your staff should be aware of that when they're helping that patient. Combining technology like wearable panic alarms and visitor management systems, along with signage throughout the system, and the signage should be backed by some sort of accountability. It really can work all together in a layered approach to improve safety in the organization. And most importantly, make safety part of the everyday dialogue. Talk about it in huddles, include it in rounding, recognize staff who use safety tools or de-escalation techniques. Culture does shift through repetition and recognition.
Thanks, Nancy and Stacy. And I'd add one final thing here, and that's really the need to ensure that solutions are scalable. So often we talk to health systems or hospitals that over the years have implemented lots of different solutions. And when they outgrow those solutions or their needs change, they end up bringing in new solutions and cannibalizing some of the investments that they've already made. This is why it's important when evaluating new technology or protocols to see how its components really become part of the process to what you've already have established. How does it integrate? How does it support what we're doing today? How does it drive the change that we need? So this is just one area where CENTEGIX, our wearable staff duress buttons, shine. Our methodology is that every staff member gets a badge, so you don't have to prioritize one unit or one role in the organization over another. This helps empower the most important asset you already have, your people. It acts as a force multiplier for your teams and response accelerator for the protocols you already have in place. Solutions like this that drive efficiency and safety can help you make a big impact with one investment.